It sure would be nice if there were some benefit to getting older. Well, hello, and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam, and I have been living with multiple sclerosis for 39 years, and I am beginning my 40th year with MS, and I'm also beginning my fourth full year with this channel. And I thank all of you for the support that you've shown me for it. I appreciate it. I hope that you're enjoying it and getting as much out of it as I am, because I think I'll keep going for a while. Well, you might remember if you've been watching the channel, and if not, no problem, because I'm going to link it below. I did a video in June of 2022, and it was called, "Can Older MS Patients Safely Stop Taking Their Disease-Modifying Therapies?" And it was looking at a study in particular that talks about discontinuing therapy with MS after a certain number of years to see if there could be any definitive conclusions drawn from that. Is there a certain age or a certain length of duration of disease or anything like that that would make it reasonable to assume that you could stop your DMT? Now, bear in mind that the DMT they were talking about was the old school stuff, beta interferon 1A, Copaxone, or Aubagio, not the new ones, not the ones that they have now, from Tysabri on to Ocrevus. Those weren't even on the horizon for us who have had MS for this long and who have been on some kind of disease-modifying therapy in the earlier phases, such as I was. I went over that in some detail in my earlier videos, so I'm not going to go over it again, but just to say that I probably could have been part of this study because I fit the criteria at that time. And so, yeah, the conclusions actually had some relevance for me, and I was very interested in them. But since the conclusions were not all that conclusive, they continued on with the study. And now there are some new thoughts on it. And I'd like to play you a couple of video clips from a couple of the doctors who have done studies continuing on with this question. The first one is Gabrielle Macaron, MD. She was part of a study called DOTMS. But it looked at the same thing, whether after a certain age we could discontinue our therapy. And here's what she had to say.
And from what I see from patients who have long-standing disease, I feel like disease duration is the main factor that makes you think that the disease is burned out. Some patients do develop the disease at 55, and those maybe have 10, 15 years of treatment that they should take. But people who are older and stop their platform therapy, they do fine, right? It's a 68-year-old for who you stop Copaxone, who's been taking it for 25 years, they just do fine.
Well, pretty similar in many ways to the study that we had looked at a year ago. I'll go ahead and play a clip from one of the scientists who was involved in the extension of the disco MS that we looked at in the earlier video. This is Dr. Enrique Alvarez. He is at the University of Colorado Medical Center, and I assume is a colleague of Dr. John Corboy, who was the lead investigator on the original study.
I think the challenge is just having a good conversation with the patient, right? Like, I think that's the biggest challenge, because I think sometimes patients feel like you're abandoning them when you're having that discussion about stopping treatment. And it's more about like, no, this is the part where now we have to really start paying attention because you've been doing well and we got to keep doing MRIs and follow you clinically. So no, you're still part of our clinic and we're still going to take care of you. But I think, yeah, the length of time becomes important. We tried to look at this last year in one of our presentations at ECTRIMS, and it got really messy from a data perspective. Because when you start looking at relapses in older patients, the reason we take these out is there's concern for other pathologies leading to symptoms coming up, or pseudo relapses. And the longer disease duration, especially in the high efficacy therapies, was associated with more events. And if we concentrated just on looking at MRI data, then we saw that it actually leveled off and we didn't see an increased level of disease activity in them. So I think, these comorbid conditions and recognizing that just because you have MS doesn't mean you can't have other things becomes really important as well.
Well, Dr. Alvarez makes some good points here. I think one of them that's important to remember is that comorbidities influence greatly because we can have things wrong with us that create symptoms and problems that seem very similar, if not identical, to the things that we deal with multiple sclerosis. And so it's always good to get that checked out. I think this is why it's so important that I've harped on this a lot in my videos, that if we have to do everything we can to maintain our general quality of life, the food we eat, the moving around that we do, if you want to call it exercise or if you just want to call it movement, one way or the other, all those things that we do, social interaction, minimizing stress, getting good quality sleep, all of those things will make a difference in how we feel in general. And so it's awfully hard to know whether we are able to consider getting off of our MS medication if our general health is not all that great. Because it's hard to tease out which is due to the MS and which is due to some of the other problems that we might have going. So visit your primary care physician or your nutritionist or whoever else is on your team and get a good workup of all of the things you would need to know and take care of things that need taking care of before you even begin to think about getting off your MS medication. Well, I want to read you a short part of an article that appeared in Medical Express in June of this summer, June of 2023, because they also make some good points. Most of the DMTs have been approved after studying only patients 55 and under, and these medications appear to have greatest impacts on younger patients with recent relapses and modest effects on slowing progressive disability, especially in older patients. Thus, benefits in older patients may remain unclear, while risks to the DMTs may increase with age. Whether it is reasonable to stop using the DMTs as people age remains an important unanswered question. Finally, Professor Gavin Giovannoni says that sometimes he will even have his patients transition off of some of the more aggressive DMTs once they get older, and he has some interesting insights into that.
Do neurologists know how long it is safe for people with MS to be on anti-CD20 therapies with continued B-cell depletion? And my response to this is, how long is a piece of string? Because no anti-CD20 therapy is safe in terms of biology. They deplete B cells, and they keep B cells depleted because you give them continuously. And we need B cells to make antibody responses to vaccines or infections. Even if you've been on an anti-CD20 therapy for 6 to 12 months, you are at risk of infections and severe infections. But those risks increase with time, particularly as the immunoglobulin levels drop with time. And so, we need to get away. Is there a period where these drugs are safe? No, there is no period where any disease-modifying therapy is safe, but it's a relative risk. So in other words, the risk of getting infections and severe infections is not that high, relative to the benefits you receive from those therapies in terms of managing your MS. And all I can say is when you look at the long-term safety data up to 10 years on people on continuous anti-CD20 therapies, those people who don't develop low immunoglobulin levels and young people who've got robust immune systems, they do well without significant side effects. This changes in people who are older, so people who are over the age of 50, particularly over the age of 55 and even over 60, as they start developing immune senescence, as their immune systems age, and they develop other diseases, comorbidities, obesity, diabetes, hypertension, the risks of severe infections ramps up, and most of the risks are in the older population. So I'm very reluctant now to leave people who are older than 55 on long-term anti-CD20 therapy. And I think, and I've said this many, many times, I think the anti-CD20 therapies are very, very good, and we use a lot of them in our practice and in my hospital. But I tell all my patients that, it's unlikely we're going to leave you on this therapy forever. We're going to leave you on them for 4, 5, 6 years, and then we will de-risk you onto a treatment that keeps your MS under control, but doesn't put you at risk of chronic immune suppression. So the piece of string, in my opinion, is age dependent, and depending on your comorbidities, and depending on what your immunoglobulin levels are doing, and depending on if you're getting infections.
Well, in conclusion, it looks to me like not a heck of a lot has really changed since I made my last video. Although I do think it's important for us to see that they are continuing to look at this issue. I also wanted to play this clip out of the old video that I made. Dr. Corboy talking about the need for a good algorithm, which we're still in pursuit of because we still don't have it.
Whether and when patients may consider discontinuation of presently available DMTs is unclear, and there's no concrete algorithm like individuals over a certain age with this many years since last relapse and this many years since last gadolinium-enhancing lesion. We don't have an algorithm like that, but we'd like to get one.
But I really do appreciate the acknowledgement that these folks make that quality of life in general plays a big role in whether we can determine our readiness to discontinue our MS medication. So if we're having any other kind of medical issue, any other comorbidity, we need to address that before we start thinking that we don't need our MS medication anymore. But as I've said, always discuss it with your neurologist. I do find it interesting, by the way, and I'd be curious to know if your experience has been different. Since I've been off DMTs for a long time now, when I go to the neurologist, we talk about some symptom management, maybe some lifestyle things, but never once has any of the neurologists that I've been seeing said to me, have you considered getting on some kind of a DMT? Because I think they just intuitively feel like, given my overall level of health and the quiescence of my MS, if you want to call it that, they don't really see that I would gain anything from being on a DMT. Now, if Dr. Giovannoni were to weigh in on this, I have a feeling what he would say would be, yes, that's nice. You don't have any acute symptoms going on. There's nothing showing up on your MRI, but you've still got smoldering MS going on. And the early therapies that these folks in the DISCO MS study were looking at are therapies that were targeted at reducing the number of relapses and keeping those white spots on our scans from increasing in size and number. They weren't at all like the ones that we have now. When it comes to the BTK inhibitors, those would indeed start targeting smoldering MS, which I know I still have going on. So I would very much be interested in knowing whether a BTK inhibitor would do me any good at this stage of my life. I've said in other videos, and I've played clips from scientists who have reminded us that you can't regain things you've already lost, for the most part. It does happen, but for the most part, if the brain is already damaged, we don't have remyelinating capabilities. And even if we did, those of us who have MS for decades are not going to be the primary candidates for those. That's not going to be that successful. I still have hope that something will be available to me in my lifetime. But in the meantime, I'm just going to, as I said, keep my quality of life as solidly high as I possibly can, because then my MS will have as little to work with as possible. And I don't know if that's a good philosophy or not, but I like it and I'm sticking to it. If you have some ideas on that, let me know in the comments. That's all I have for you for now. But until my next video, I want you to take really good care of yourself. We'll see each other again.